So today I'll be doing a head-to-toe assessment, and I'll be covering neuro, cardiac, respiratory, and MSK. So I'm going to start off by introducing myself. Hi, my name is Toke. I'm a level 2 nursing student, and I will be doing your head-to-toe assessment today. Can I ask for your name? Mr. Smith. All right, so I'd ask for the patient's name, and then I would go on with the assessment. So hi, Mr. Smith. So today I'll be doing a head-to-toe assessment on you. I'll be checking your abdomen, your respiratory system, your cardiac system, and your muscular system. So the purpose of the exam is to do the assessment. It should only take about 15 minutes. Mr. Smith, so today we're gonna head on with the focused health history for your neurological exam. So I'm gonna ask you a few questions. I just also wanna make sure that you know that everything here will be confidential. So do you have any headaches? Do you ever feel lightheaded or faint? Any shakes or tremors in your hand or feet? Do you have any weakness or problems moving any parts of your body? Do you have any problems with your coordination or balance? Do you have any numbness or tingling in any body parts? Do you have any difficulty swallowing? And do you have any difficulty speaking? So these are all questions about his health history in the present right now. Now I'm going to ask questions about his past. Have you ever had any headaches or spine injuries? A stroke, infection in any part of your brain? Have you ever had a seizure? Have you been exposed to any environmental hazards? Okay, so now I'm going to assess their mental status. So I can tell that my patient is awake and alert and oriented, and they're responding to all my questions. And I'm going to assess and ask them about their orientation. Mr. Smith, do you know where you are? Do you know what time it is? And do you know who I am? So Mr. Smith said that he knows where I am, what time it is, and where he is in the hospital, so I can give an okay for his orientation. So the first thing I would test is for his olfactory nerve, and I would hold up something to his nose for him to smell, and he could tell me what it is. For example, if I held up a piece of gum to his nose, he could tell me that it's mint flavored. Then I would assess his optic nerve. So next I'm going to be checking Mr. Smith's optic nerve. I'm going to do visual acuity, which is basically taking an eye chart and where he reads letters from about 20 feet, and then he'll tell me which ones he can read. And then I'm also going to test for his peripheral vision to see how well that is. So I would take him to read the eye chart, and if he can read it properly, then that's good. And then I would do, to check his peripheral vision, I would tell him to close his left eye or right eye at the time, and then I would bring my fingers up, and then he tells me when he sees them, and then I would do it to the side, and then I would do it below, and then to the other side, and then I would repeat that for the right side, and then Mr. Smith would tell me if he's able to see them or not. Now we're gonna check Mr. Smith's ocular, trochlear, and abducens nerves. So first I would do the pupil. So now I'm going to check Mr. Smith's facial nerve. I'm going to ask him to smile really tight, and then frown, and then close your eyes really tight. All right. And then lift your eyebrows, show your teeth, and then puff up your cheeks. Now I'm going to check Mr. Smith's acoustic, and I'm going to whisper in his ear and tell me if he can hear what I'm saying. And then he repeats it back to me. And then I would do the Weber's test or the Rhines test using our turn fork, but I don't have one at the moment. But I would just hit it and then put it above their head, and they tell me when they hear it stop ringing. Then I would look at their glossopharyngeal and vagus nerve. I would look at their tongue and then their palate, and I would look at their nose movements, and then I would also have them say ah. I'd watch them talk and swallow to assess their nerves. Okay, then I would ask Mr. Smith to turn against my hand and shrug against my hands to look at their spinal accessory muscles. So Mr. Smith, can you turn against my hand, and shrug up against my hands, and I can assess that he has very strong sternocleidomastoids and trapezius muscles, as he's able to turn his head against the resistance. All right, then I would look at his hypoglossal nerve, and I would look at his tongue while he says tight, light, dynamite. So Mr. Smith, can you say tight, light, dynamite? Then I would observe his tongue muscles to see how well they are working. All right, then I would palpate against palpate his motor muscles, like his arms, his neck, his jaw, to see if there's any, his arms and legs also, to check the tone, see if there's any lumps, bumps, or if there's any tender areas. Then I would also look at his cerebral function. So Mr. Smith, can you get up and walk for me? I'm just going to check your gait to see if it's normal, to see how you walk. So then he would get up and walk. Then, okay, perfect, thank you, Mr. Smith. So then I'm going to look at his Romberg test. But I would need, so Mr. Smith, we're going to do a Romberg test. So I'm going to need you to do a shallow bend at the knees. So he would bend his knees, have a shallow bend at his knees. And then I would also ask him to hop on, or he can either hop on one leg. So, okay, now I'm going to assess his coordination and his skilled movement. So I would ask him to do either finger to nose. So I would go like this and have him go like this, or have him do thumb to finger. So Mr. Smith, can you touch your nose and then touch my finger? And then are you able to do a finger to finger? Okay, or can you heel to shin? All right, so Mr. Smith can demonstrate those very well, and he's very coordinated. It's really smooth, so he has no problems there. So after that, I would document expected findings, unexpected findings, things that I noticed about Mr. Smith that are unusual or that aren't from his baseline, and I would document